Hi, today we'll be looking at suicide prevention, a Lloyd&Lloyd Parent Workshop series presented by myself, Tonya Lloyd, Clinical Director of the Resilient Stars Program. As usual, we'd like to give Ms. Tamara Cooper a special thank you for the opportunity to present to you virtually. What will you gain? A discussion of operational definitions, suicide, suicidal ideation, resilience. A brief interview with Dr. Gerard Hutchinson, Head Psychiatry, University of the West Indies. Suicidal risk factors and knowing what to do. Understanding the elements of a suicide prevention plan, and of course, resources. And whenever students are referred to our Resilient Stars program or we have to refer for additional counseling support services, usually teachers are presented with a letter or they discover a letter based on children just writing during essay time or story time and expressing a deep sense of pain and a desire to end their lives. And our life skills program teaches students how to build their emotional regulation, which would help them mitigate feelings of depression and anxiety, as they would know how to identify what they're going through and know how to work through that. And one of the most challenging, I think, aspects of any mental health field includes having to share with loved ones, particularly when we're dealing with minors, having to share with parents in a very in a way that has a lot of empathy and clarity with regard to next steps. Is your child has expressed suicidal ideation. And of course, following up with parents and following protocol based on each school's requirements for such instances. Next, we'll look at statistics on suicide in the U.S. Suicide is the 10th leading cause of death in the U.S. for all ages. Every day, approximately 123 Americans die by suicide. There is one death by suicide in the U.S. every 12 minutes. Depression affects 20 to 25% of Americans ages 18 and over in a given year. Suicide takes the lives of over 44,965 Americans every year. The highest suicide rates in the U.S. are among whites, American Indians, and Alaska Natives. Only half of all Americans experiencing an episode of major depression receive treatment. 80 to 90% of people that seek treatment for depression are treated successfully using therapy and or medication. An estimated 250,000 people each year become suicide survivors. There is one suicide for every estimated 25 suicide attempts. There is one suicide for every estimated 4 suicide attempts in the elderly. Right, so we do have specific populations that we want to be mindful of, and that also doesn't mean that we are not to be mindful of other populations. It's just knowing our risk factors and knowing more can help us do more a lot sooner. We're now going to get into the operational definitions. Suicide, the act of killing yourself deliberately, according to the Oxford Dictionary. Suicidal ideation, thinking about or planning suicide, a detailed plan to a fleeting consideration. And of course, suicidal ideation does not need to include a plan. Resilience, the capacity to recover quickly from difficulties, toughness. Our logo is because tough is a state of mind, and that's where we believe that training or giving students the skills, the life skills to increase their executive functioning part of their brain really helps them to learn how to enhance their emotional regulation, how to enhance their focus, how to plan their goals and execute their goals. And this is very, very important to create grit, to increase grit, and to create a buffer for things like depression and anxiety to mitigate that. Next, we're going to get into our interview with Professor Gerard Hutchinson. He's head of psychiatry for the University of the West Indies, the Clinical Medical Sciences Department, and the head of the North Central Regional Health Authority, Psychiatric Services. Question 1. Is there anyone to blame when a child shares that they have suicidal ideation? The answer that Professor Hutchinson gave was no. If a child shares that he or she has suicidal ideation, does this mean he or she has a mental health condition? The answer, not necessarily, but it might mean they are in some form of psychosocial distress or problems dealing with some stressor. What steps should a parent take when a child states he or she is suicidal, or when the parent learns the child has had prior suicidal attempts? Answer from Dr. Hutchinson: listen to the child's problems, provide unconditional support, get professional mental health help. And the last question, is there a way to prevent a child from feeling suicidal or attempting suicide? Dr. Hutchinson states, early intervention when the child has problems at school, home, or socially. Recognizing mental health issues, example, depression, and nurturing open communication. And I'm very, very grateful to Dr. Hutchinson for taking his time and sharing some of these insights with us. Next, we'll be looking at the risk factors for suicide. The persons tend to be male, they're successful, quote unquote, or suicides that are carried through are completed by males. The persons may have bipolar disorder and substance use disorders. They may have been ill for a short time and had only a few bipolar episodes. Panic attacks, agitation, restlessness are other indicators. Prone to impulsive acts such as driving recklessly or violent acts. Recently hospitalized and previously tried to kill themselves. And so I know when I was working with Dr. Hutchinson and in the early 2000s, one of the interviews that I had to do was when we had to decide on it. The decision had to be made on releasing a patient who attempted suicide, and really trying to understand thoroughly that they were ready to resume their daily life activities. And they were ready to participate in follow-up, psycho education and psychiatric services. Risk factors for suicide continued. One or more relatives in your family tree committed suicide. If and when you're taking a child to, say, the Rutgers Behavioral Health Unit or crisis, one of the questions I'll always be asked sounds something like, do you have any relatives who committed suicide or had mental health challenges? And it's usually trying to connect for the genetic component. Experience a stressful life event involving loss, isolated from friends and family. This is why this presentation is so important, particularly during this time of social isolation. For us to make sure that we really do all we can to reach out to our community. Huge kudos to Mr. Mara Cooper and the board of trustees and the entire family and staff where there is a wellness committee and calls made daily to reach out to the families and to students, and to make sure that we keep in touch with everyone. If the person does not have ready access to a psychiatrist or psychotherapist, if they have thought about a specific plan, And if they have nightmares of self-harm, I remember one scholar bringing this to my attention that they were having a lot of nightmares around harming themselves, and of course they were referred out for extra counseling, and they are doing very, very well now, back on top of things with their academics and overall managing a lot better. And they're also still part of our Resilient Stars program, and continuing to thrive. Right, so it's important to understand that kids could bounce back, that human beings could bounce back from experiencing such lows as we would call it, or depression, into realizing that they can learn the skills to manage these challenges a lot better. What to do when someone states they want to kill themselves? Now, let's say, if you're dealing with a minor, of course, you report it to their parents, the school leader, and follow the protocol for a medical review. Each school might have their own way of dealing with crisis situations. Make sure that you're very familiar with that. Adults, ensure that they contact their healthcare provider. Try to stay with them until you've made sure that has been done and that they have the support. Elderly, ensure that they tell their healthcare provider. Again, one of the things that people fail to report suicidal ideations, or they sometimes fail to even ask about suicidal ideations, has to do with a sense that that they might be betraying the person who confides in them. And just to let you know this, that students actually reported that they would prefer that the person tells, or the person lets somebody else know, because that would show that they care, right? So it is very important, if you are in the field of mental health, that you always have to say, there's 3 things that you cannot keep confidential, and those of us in mental health are aware that those 3 things has to do with suicidal ideation, homicidal ideation, elder abuse, or other kinds of abuse to the person, that we cannot keep those things confidential. Next, we're going to be looking at how to protect yourself from carrying out suicidal actions. Get rid of means to hurt yourself, whether that's licensed firearms or weapons or pills. Get rid of them. See your psychiatrist and therapist immediately. So people have asked me, some families have asked me, what's the difference between a psychiatrist and a therapist? A psychiatrist prescribes medications. In some cases, we have psychiatric nurses as well that do the same. And therapists provide talk therapy, right? And so a combination of those 2 have been proven to be the most effective when dealing with mental health conditions, right? But of course, you have the opportunity to discuss these options. Use your core circle. What do we mean by core circle? People who are supportive, who are understanding, they have empathy, and they know the actions that have to be taken when it comes to mental health, right? So, for example, you might have a person who's a listener. You might have a person who makes you laugh, and anytime you go to that person, they're going to have you rolling with laughter, regardless of the mood that you're in. And you have a person who's going to be really strict with you and say, okay, this is looking serious. We're taking you to see your doctor right now. Those 3 people, one to take action, one to help relieve the situation, and one who just, who has a lot of empathy, right? So having just 3 core people would be enough, trusted people, right, within your circle, and you identify them beforehand, and they know that they're going to be a part of your plan, a part of how you help yourself. Review your reasons for living. It's always good to, make a list of the 10 top reasons that you deserve to live, or you want to live, 10 top reasons. and you could always expand to 20 top reasons, etc. Improving the moment tools, learning how to tolerate the stress, whether that is doing your belly breathing or progressive muscle relaxation, knowing how to self-soothe. It's really important. Next, we'll be looking at elements of a suicide prevention plan, and we're looking at what you could do if you are the person experiencing suicidal ideation. Of course, reach out to your healthcare provider. You could share this list with them, and or I'm sure they have their own lists and their own strategies. This is just additional information. So if you're having a depressive episode, again, we reiterate, get rid of all dangerous weapons, contact your psychiatrist and therapist, implement your behavioral action plan by scheduling rewarding or distracting activities, whether it's watching a comedy, taking a piece of paper and ripping them up into tiny little bits, pretending that you're blowing a balloon and you put all of the most stressful things in that balloon, and you watch that balloon go up and up and up until you can't see it anymore, right? Listening to your favorite comedians. Okay. Number 4, ask your core circle for support. It's always good that that they have advance notice. Sometimes that's not possible, and that's okay. Agree not to hurt yourself if they haven't had a chance to get back to you. Elements of a suicide prevention plan continued. Practice meditation or relaxation techniques. Exercise, right? We have a lot of great exercise programs on YouTube, such as Billy Blank's, right? The Taibo, the box outs. Really, that's a number one activity for the men and the boys that's part of our program. They really love it. The girls are getting into it too, but we got a lot of good feedback from the boys that they just love it. They love the Billy Blanks, Taibo, punch outs, etc. Just 8 minutes a day. Rely on input from religious or spiritual sources. So again, you have your communities, whether it's your church or your mosque or your temple, right? So, reach out to your religious guides and just a little, going back a bit in history, where psychology started off as the study of the soul. And that spiritual element or that sort of getting peace of mind, it's a really, really powerful element for us to bear in mind when coping with these types of challenges. Review your reasons for living. Now, what are some of the things that your doctor or therapist can do? See you on an emergency basis, modify your medication regimen. So again, as I've told parents who just had their children diagnosed and they've just started a medication regimen, to please talk with your doctor regularly. Say things like, my child is gaining a lot of weight. Please let me know what I could do to counter this, because some of the medications might increase the urge for eating, and that might be a side effect, right? You want to really observe your child, document changes in sleep, document changes in eating, all of any change that you say, okay, no, this is not how my child was sleeping or eating or talking prior to these medications, and really reach out to your medical provider so that they could adjust accordingly. They could adjust or cut back on the medications or add another medication to counteract the effects of one that has been prescribed, or just change the medication altogether, right? So it's important to have these dialogues going. Arrange for hospitalization if necessary. Help you understand where your suicidal thoughts are coming from and what effects they have on others. Work with you on behavioral strategies for handling painful thoughts and emotions, right? And so again, some of those strategies include keeping a mood log, testing unhelpful thoughts, right? And understanding our core beliefs and automatic automatic thoughts that we may have at times that may really be unhelpful and sort of encourage rumination and things that lead to this cycle of depression. So those are just a couple behavioral strategies that could help. Now, circle those things that your core circle can do, right? So that's letting people know how to help you and what works. They listen to you, validate your feelings, and offer suggestions, right? Avoid being critical or judgmental. Please avoid saying things like shake out of it, snap out of it. Remember that this is a real chemical imbalance, which is why medicines help these chemicals to focus on parts of the minds where these chemicals are produced. Another point is to distract you through mutually enjoyable activities, looking at a comedy or creating something together that you enjoy doing. Help you to take care of responsibilities that have become burdensome or difficult to perform. Stay with you until you feel safe. Again, I know that in these times with the social distancing, perhaps staying with you on a video call, WhatsApp, or another video call or Skype might be useful. Call your doctor to help you arrange an appointment, take you to the hospital if necessary, agree to store your weapons or pills away from you. Right, so you do need that person who's going to say, hey, okay, where do you have your stuff? Like, seriously, pass it over. And I think we all have that no joke kind of friend that's just going to tell us as it is, right? And we have some resources here. There's suicide. We're in New Jersey, and so all of these resources are for New Jersey specific. The hotline, the Hope line, right, as well as a book that we've used to share some of these insights. The Bipolar Disorder Survival Guide, what you and your family need to know. We are going to add these resources in the YouTube description and description so you could get these links. In conclusion, we've discussed operational definitions such as suicide, suicidal ideation, resilience. We had a brief interview with Dr. Gerard Hutchinson, head psychiatry, University of the West Indies. Very, very grateful for the time he took to provide us with his insight. Suicidal risk factors and knowing what to do. We understood the elements of a suicide prevention plan and resources. Thank you so much again. Thank you to Ms. Tamara Cooper and our school communities. Thank you to Dr. Hutchinson for his interview. Right, thank you for all of our supporters out there. Please feel free to like our video and subscribe. We'll be sending out one of our trainings every month. Bye for now.